guest speaker session. Today with us, we have Dr. Schmidt, who is a professor of health policy in the School of Medicine at University of California in San Francisco. And she also holds a joint appointment in the Philip R. L. Lee Institute of Health Policy Studies in the Department of Anthropology, History, and Social Medicine. I just want to say before we get started is feel free to turn on your cameras and when questions, and then feel free to turn on your mics also to ask questions during the 15-minute period that we have. And you could go ahead and get started, Dr. Schmidt.
Sure. Great. I'm going to share screen and put up some slides. And can you guys see my PowerPoint? Great.
Yeah, we can see it.
Terrific. So I'm just going to talk a little bit about the work that folks in my lab have been up to at UCSF. And this is our work. Sometimes I like to talk about what we do as we have a lot of frustrated doctors on our hands at the medical center in that they're treating one patient at a time. And when it comes to big problems like the obesity pandemic, we're really in a situation where we need to be treating whole populations of people. And the way to do that is through policy change. And so my team, we really study we're interested in turning the dial on the obesity and cardiometabolic disease pandemics. And the way we try to do that is through the rather crude lever of sugar sweetened beverage or soda reduction. It's a tool in the arsenal to deal with the obesity crisis. So this is a pretty stunning set of slides that just give you a sense of the scope of the problem. This is the baseline slide. It's showing you the change globally in obesity rates between 1980 and 2015. Okay, so keep an eye on places like China, Brazil, and the US, where we're already seeing an uptick in obesity rates. So this is now the difference between, this is the difference between 1980 and 1985. So 5 years there. This is the difference between 1980 and 2000. So already within that period of time, we're seeing an almost fourfold increase in obesity rates in China. And this is changed between 1980 and 2015. So now we're seeing an almost eightfold increase in obesity rates in China, 2.5 here in the US and in Brazil. So we're seeing rising rates of obesity happening all over the world, but particularly, I mean, nowhere is our rates going down. Only in a few places are they stable in parts of Africa and Asia, but mostly they're going up, and in some places by really dramatic changes. And so a lot of people, a lot of the way that we try to address obesity in the US, going back to that individual focus, one patient at a time, is we wait for people to get obese and diabetic, and then we treat them. And it's not working, as you can see from these pictures. It's not like all of a sudden the populations of China, Mali, the US, Brazil lost their willpower, stopped dieting, stopped exercising, and we should view this as a problem of individuals. In fact, it's the opposite. We need to be viewing this as a global health crisis that's happening independent of what individuals do. So this was a paper that came out. Millbank Quarterly is a really great medical journal that is a lot of the time they do reviews, and they're very policy oriented. And this particular one recently came out this year, and they were looking at obesity policy in England and what overall has happened with that country's really significant efforts to curb the rising rates of obesity and cardiometabolic disease. And what they concluded is that essentially the whole system of intervening on obesity had failed to reduce the prevalence. And these failures had led to insufficient or no learning or change among governments. The governments were sort of throwing the same spaghetti at the wall over and over again and trying to see what would stick. And the goal of the message of this analysis was really to prioritize policies that make minimal demands on individuals, that don't ask people to go join a gym, don't ask people to stop eating hyper-processed foods, but that are population-wide and address the entire food environment independent of the individuals within it. So strategies that just make it easy to maintain a healthy weight. And that's what we're up to at UCSF. So the way I come out of an addiction science background, and the way I like to think about the problem is actually in that framework. We have this issue in the substance abuse literature that we call it environmental saturation. So if you grow up in an urban ghetto poverty environment, you're going to be literally having alcohol outlets on most corners, like in the San Francisco Tenderloin. We have 45 liquor stores in a few blocks worth of geography within the city. And a lot of the time there's going to be illicit drug activity around those outlets and poorly managed and regulated drug activity. And so it's no surprise that people who grow up in such an environment have much more access to alcohol and drugs. And therefore, because of their heightened access, due to environmental saturation of liquor stores and drug dealing venues, they tend to have higher rates of alcohol and drug problems. If you took the same individuals and put them in environments that were not saturated, you would likely see something quite different. Now, a lot of what we do in the battle to prevent and turn the population tide on obesity is learned from lessons from the tobacco experience. As you can see here from this slide, in the this is basically the 20th century, right? And right around 1965, the Surgeon General's report on tobacco consumption came out, and it made the headlines of all of the newspapers, and people really started to look up and ask, well, wait, this thing that is so cool, smoking, maybe it's not good for my health. And then you start to see that consumption curve go down over the course of a few decades. And what you see is about 10 years later, you see the tipping point in rates of lung cancer, and then they follow that consumption curve. The difference between this point, the consumption curve, and the disease outcome curve is about a decade. And that's because it takes time to develop lung cancer over years and years of smoking. So something like obesity or diabetes is going to have different time lag between the consumption curve and the disease outcome curve, but we'll still see we can drive down that sugar sweetened beverage consumption curve, which we will in fact see changes, and we are, in type 2 diabetes rates and other health outcomes associated with obesity. So effectively, I like to call this principle that really comes out of addiction research, but applies to the obesity pandemic, the iron law of public health, that if you can essentially in one way or another make something harmful to the health of populations less available in the environment. So going back to that England policy report, just make the environment a healthier place for people to navigate, that will reduce consumption. And therefore, when consumption goes down, that will reduce harms to health. So what we're doing here is we're taking the burden off of the individual to navigate a saturated environment. And we're creating an environment that actually turns the dial down on environmental saturation of junk food outlets and sugar sweetened beverages and so forth. And so it turns out from the history of tobacco control, alcohol control, and other related public health crises, there are really, there's just almost a generic toolkit of things that seem to work pretty well to address this, to basically invoke the iron law of public health by desaturating the environment. You can make the unhealthy stuff more expensive. And so that's why we recommend taxation, whether we have taxes on alcohol, we have taxes on cigarettes, and why not have taxes on junk food and sugar sweetened beverages? You can also alert consumers at the point of sales when they go to buy the junk. You can even simple things they call choice architecture, where you just move the junk behind the counter at the CVS, like we now put cigarettes. And it's just one, a lot of this is capitalizing on human laziness, that if I have to actually go and get in line and ask that counter person in the pharmacy for cigarettes, it might be a little less likely to do it. There's also counter advertising, warning labels. So this is essentially making the product a little less popular seeming, cool seeming. So you'll see in putting a warning label on the front of a junk food package is proven extremely effective in countries like Chile. Parents stop buying stuff if there's a label saying this is not good for your child. There are whole messaging campaigns that can be done, rolled out on social media, a variety of ways to just get the public's mind around, hey, maybe people shouldn't be consuming this stuff. And then there are also private sector policies. So I'm going to show you a little bit of examples of the creation of workplaces without soda sales. And we know from indoor air laws that when workplaces, employers started to just insist that people can't smoke in buildings, it made a huge difference in cigarette consumption. So a lot of people ask, like, why do you guys, we have this obesity pandemic, the causes are very complex and multifactorial. So why would you be focusing just on sugar sweetened beverages? And there are a few reasons for this. One is it's low-hanging fruit from a public health standpoint. It's a crude category of hyper-processed foods that are, they account for about 36% of the sugar in our diet. We know that sugar consumption, excessive sugar consumption, is driving not just obesity, but it's also driving an epidemic of fatty liver disease. The simple sugar fructose, which is about half of table sugar, is almost exclusively metabolized in the liver. And when our livers are overloaded by soda, because it's not very satiating, the fructose hits the liver really quickly, it can overwhelm our body's ability to manage that kind of an influx of sugars. And so these are the reasons why we focus on sugar sweetened beverages. Increasingly, people in my world are starting to define hyper processed foods, so distinguishing hot pockets and toaster things from broccoli, right? Food is a lot more complex than alcohol and tobacco. And so a team in Brazil has come up with a system for ranking foods and classifying foods on the basis of what is really hyper-processed, essentially fat, sugar, and salt loaded with chemicals, colors, and flavors to entice consumers, as opposed to less processed foods. Even bread is somewhat processed. But if you're making your own bread in your kitchen, don't worry too much about about hyper processing. But increasingly we've started with sugar sweetened beverages because there's such an easy low hanging fruit, but we're moving towards the broader category of hyper processed foods. So as you can see from this graphic, we are already winning the war on soda. The population started about the late 90s. We saw the tipping point in that consumption curve, just as I showed you for tobacco. And by 2015, we had really reduced our soda consumption in the United States. And we are seeing beneficial, a downturn in the incidence of type 2 diabetes that is consistent with the kind of time frame here. Now, if you look at the long trend over time, so Coca-Cola and Pepsi were invented in like the early 20th century, late 19th century. So look at how low consumption was in the 50s, and then just look at that sweep of consumption. So in the longer time frame, from the low, we got a long time and a long way to drive down that consumption curve. There's plenty of room for improvement. One of the challenges to a picture like this, when you see consumption going down like this, is that what's happening is that the companies, as consumption goes down in the US, are exporting soda to low and middle income countries around the world. And that's why we're starting to see rates tick up in parts of Africa and in parts of Asia, where populations really didn't have a sugar habit and weren't exposed to a lot of soda prior to the downturn in the US. So one of the key success stories in all of this is soda taxes. And I've worked very closely myself with policymakers in the Bay Area to launch soda tax campaigns. In the US, we currently have these 4 in the Bay Area. I work closely with the Board of Supervisors in San Francisco. Berkeley passed first. Except that the Navajo Nation actually preceded Berkeley, but it's not technically a US city, it's a tribal area. We have one in Seattle, Boulder. The Cook County one was repealed, and in Philadelphia. And in every one of these cases, it was a massive battle against the soda industry. To the soda company, American Beverage Association, spent $7 million just on a given city in the Bay Area to try to beat back these taxes, because they know they will lower consumption, and therefore people will drink fewer of their products, and it'll hit their profit margins. The even more hopeful story is internationally. We now have almost 40 nation states, so not just cities, but whole countries that have adopted taxes. The real turning point in all of this was Mexico, which had the largest soft drinks market in the world when it passed its tax in 2013 and implemented in 2014. And since then, they have seen consumption rates really plummet. So here is some data from the Berkeley natural experiments looking at the Berkeley tax. And as you can see, SSB consumption has gone down post-tax, whereas non-taxed healthier beverages like bottled water went up. And this is a similar story with Philadelphia. And one of the cool things about the US city taxes is that in every case, the cities involved have rolled the tax proceeds into programs for, this is Oakland, into programs for communities of color and nutrition education, food programs, and a lot of it's gone into getting clean water out to the population. So I'm going to just briefly share a little bit about one of the cool things. Maybe some of you guys will apply to UCSF for med school. And it's a really top-notch medical school. I love working there. And I want to tell you about one of the reasons that I really love working there, because I was able to work with a couple of other folks on our campus to convince leadership to launch what we call a healthy beverage initiative. Really what this is a soda sales ban. Basically what happened is UCSF, we're a health sciences campus, and we just decided that we were going to get ourselves out of the business of selling soda. Our hospitals were filled and clinics were filled with patients with diabetes and cardiometabolic disease. And so it really started to feel kind of hypocritical for us to be making money off of sugar sweetened beverage sales when people like me working within the university were doing science demonstrating the health harms. And so in 2015, the university made the decision to stop selling sugar sweetened beverages everywhere. And this was vending machines, cafeterias. We have tons and tons of vendors on our campuses and in our hospitals. All of them stopped selling. We even took it out of patient menus within the hospital. And so I'm going to show you some evaluation research data on this. Prior to our research, there had been a few health institutions that had tried this approach. So a sales ban is different from a total ban. A sales ban just means the employer or the institution decides to stop selling soda. But anybody who works there or comes there can buy it off campus and bring it in. You can put a 6-pack in the fridge at work. There's no moralism about it. It's just, as an employer, we decided that this wasn't really something we wanted to be making profits off of. And so we conducted a survey of a representative sample of a couple thousand UCSF employees. It's a really big institution. We have about 20,000, 25,000 employees. And then we also did complete physicals, including fasting blood draws on a subsample of people who were drinking tons of soda at the beginning but prior to the sales ban. And this is just giving you an example. Every vendor at UCSF went along voluntarily in this agreement. So we're literally talking about sitting down with Subway or sitting down with Jamba Juice and saying, you can sell beverages, they just can't have any added sugar in them. And we literally got Jamba Juice to reformulate their smoothies so that there was no added sugar. It was just whole fruit and whole juice. And that was true. We have, whole parking lots of food trucks. And, this is just a real testament to what people can do when they put their minds together and they get behind something. In cases where a vendor didn't want to participate, we would, I would literally sit down with them and show them the data and say, do you know anybody who's diabetic? I bet you do. If that, if you're a person of color, and so, you probably have a 4 times more likely chance that someone in your family's type 2 diabetic, and just really walking them through the science. And it was remarkable to me. And now we require any vendors who come onto our campuses to agree to not sell soda. But at the time that we launched, we did it voluntarily. Our chancellor insisted on that. So here's what is okay you can sell fruit juice, you can sell anything that has no sugar in it. You can sell plain water, you can sell flavored water, you can have sugar packets on the side, but you can't make those Starbucks smoothies with all the sugar in them. So I'm going to show you some of the data from our study evaluating this approach. So folks are probably aware of health disparities and the tremendous inequality in health outcomes across our population. And that's true even in a public university like UCSF. People in our service manual, janitors that work in the campuses and hospitals, our police force, they are the lowest income earning occupation group within the UCSF community. And they, at the beginning of, prior to the Healthy Beverage Initiative, on average, people in this occupational group were drinking almost a liter a day of sugar sweetened beverages, 30 ounces per day. then you go up the income strata to our medical staff in the hospitals, and they were only drinking like 4 or 5 ounces a day. So right away, you can see that an environmental change in the entire food environment, where we're not asking individuals to do anything. You can even go out of your way to bring this stuff in and drink it at work. We're just not selling it anymore. And you can see what a big equity difference it makes. This is the decline in SSB consumption following a year after the sales ban. And you can see that the very groups that were most at risk, they were drinking a third liter a day on average, were now down about 25% in their consumption. So you're talking about taking a lot of sugar out of people's diets. And again, our medical staff, academic staff that are higher income, they weren't drinking a lot at the beginning. So who cares? They probably didn't even notice that we stopped selling soda. And so here we have what's great about public health interventions that change the environment is that they automatically re-rig the environment. The environment is set up to disproportionately make lower income populations sicker. And so by cleaning up the environment, we re-rig that environment to make those disparities narrow. So that's a really important aspect of this kind of public health stuff. So this was about a little over a year ago. We published the results of our, as I mentioned, we did complete physicals on a subgroup of our employees who started out drinking a lot of soda every day. And we published the results of that. It was actually a clinical trial, and we published them in JAMA. And here's some of what we found. Now, these are folks that before the sales ban were drinking a lot of soda. On average, they were drinking over a liter, 35 ounces. And by 10 months following the sales ban, they were drinking 18 ounces. So within this really heavy segment of our workforce, we saw this was a 45% decline in SSB consumption. You can imagine what their livers and pancreases are cheering to be freed of that excess burden of sugar. And what's really cool is that we showed that abdominal adiposity, waist circumference, went down significantly. This is in centimeters. This is almost an inch in waist circumference. So the important thing about abdominal adiposity, BMI didn't change, although sub-analyses showed that within certain overweight and obese segments, actually BMI did, a lot of people lost weight just by taking soda out of their workplace environment. But what's abdominal adiposity is associated with cardiometabolic disease risk. There are 5 criteria that make up metabolic syndrome, and metabolic syndrome is a universal predictor of heart disease, stroke, and other forms of cardiometabolic disease. And one of the 5 criteria is abdominal adiposity. So people who are apple-shaped are more at risk than people who are pear-shaped. And so to see a change in not necessarily population-wide in BMI or body mass index, that's weight by height, but to see it in abdominal adiposity is really encouraging, because it suggests that people's health, underlying health, not just their weight status, but their underlying health could be improved. And here's a demonstration that this again, people sometimes talk about precision public health. In this case, the intervention made a much bigger difference in consumption and waist circumference for people who already had overweight or obesity. So again, these environmental interventions, not always, but often target the populations most at risk. And so therefore, you're looking at reversing disparities. Now, here's really encouraging evidence from the blood. We did fasting blood draws before the sales ban and then 10 months later. And what we're seeing is this is the correlation between sugar-sweetened beverage consumption as people reported it, and all of these blood biomarkers. This is the standard metabolic panel that you run for establishing the presence or absence of metabolic disease risk. And you're seeing changes in lipids like cholesterol, but here's the cool thing, HOMA. HOMA is a biomarker that is a wonderful biomarker for measuring, a very sensitive one for measuring insulin sensitivity. So essentially, the more insulin resistant you are, the more likely you are to be pre-diabetic or diabetic. And so to see a change in insulin sensitivity, that's your smoking gun telling you that for people in this study that benefited from the sales ban by reducing their consumption, they got a health benefit out of it. They were less likely to develop diabetes and other cardiometabolic disease outcomes. So what we did, which was really interesting, Sanjay Basu, who's at Harvard now, he was at Stanford when we conducted this study, is that we took the effect sizes. So these kinds of numbers, the effect of and in fact, it was the change in SSB consumption that we looked at. What would happen if, in terms of healthcare spending and workforce productivity, if you were able to scale up a sales ban like the one at UCSF across a whole institution? And so this is called economic microsimulation. And so it's a wonderful tool for just estimating what would happen if you could scale up something like a novel food environment intervention like the sales ban across a large population. And the reason we do this is because this is an audience. Employers spend a lot of money on diabetes. It's one of the top 3 rising health conditions in terms of costs. And so this is an audience for adopting interventions like the sales ban. If employers around the country, our big corporations, became convinced that they could save buckets of money off of something as simple as a sales ban, we might see widespread diffusion of the intervention. And so that was the logic behind conducting this kind of analysis. And what it showed is that the Healthy Beverage Initiative saves about $300K per 10,000 employees over 10 years. So this is like really conservative assumptions, like you don't get any, all of your money going to beverage sales is lost and so forth. And so we're both, employers will save money both in healthcare costs and also in productivity costs, because folks with obesity have a lot of challenges when it comes to actually carrying out their job duties. In addition, some colleagues of mine, David is at UC Santa Barbara and Jenny is at UCLA, and they're environmental scientists, and they looked at what happens to greenhouse gas emissions if you try healthy beverage initiatives. And so they do something called life cycle analysis. And what they found was that they found significant reductions. And, when we started out at UCSF, it never even occurred to us that sales ban might be a planetary health intervention. We were just concerned with diabetes rates and getting ourselves out of the business of profiting off of something we knew was making people sick. And lo and behold, they show a small decrease in greenhouse gas emissions, and it was largely due to packaging. And so what came out of this is that currently the UC system is 10 campuses spread all over California. It's the largest public university in the world. And so the idea that you could take something that got kind of incubated as an innovation at UCSF and get all of these other campuses across the whole state, a state larger than a lot of European countries, to stop selling soda, you could really, really make a dent in population health. Plus, you could make the university a real kind of trailbreaker for this kind of novel intervention. Something that before UCSF tried it, we didn't even know if it worked. There was no publication out there or study on it. And so when we started to scale across the UC, all 10 campuses, We've been working on this for a couple years now, and there are a lot of moving parts to this. One is increasing tap water access. So we convinced the University Office of the President, which is the system-wide across all 10 campuses, to spend just under $2 million just getting those tap water bottle filling stations out on our campuses. And a lot of that was the idea that we would particularly learning from the environmental and climate scientists working with us, that having that free, healthy substitute to sugar sweetened beverages would really steer people towards an environmentally sustainable and also equitable options. So again, students may have less money to spend on bottled water, right? So we don't want to take the soda out and force them to buy bottled water when we can install tap water stations and encourage them and so here is where we think we may achieve really profound greenhouse gas reductions, and as we roll this initiative out. So we're currently still, there are a few campuses that are still getting their water stations installed, but most of them are in. And we're also rolling out social marketing campaigns that try to make water more attractive and encourage people to just get a bottle and refill. And then we're also conducting work on SSB reduction. And this is going to, there are a lot of moving parts here. It's very, very political. It turns out that all 9 out of 10 of our campuses have exclusive pouring rights with contracts with Pepsi and Coca-Cola that mean that the university agrees to only sell Pepsi or Coke. Like at UC Berkeley, Pepsi is the Cal Bears mascot beverage. There are many layers. If you want to, you can ask me questions about it later. But this is turning out to be these contracts with the beverage companies are turning out to be a real barrier, and we're developing some super interesting innovations in that area. So if you're curious, I can let you know in the Q&A. And then and so, I always like to close talks with, because people at the end of the day, we're kind of all about, people hear about how challenging and harmful sugar and hyperprocessed foods are, and they want to do something about it. And a lot of the solutions politically are really a heavy lift and require a lot of time and effort. And so people always want to know, well, what can I do now? And my biggest recommendation is to get this stuff out of your personal food environment at home. If you don't buy it, you are basically capitalizing on your own laziness. And it's a great public health intervention to just not have hyper-processed foods and beverages to the best of your ability in your house. And then that means you have to go out and get it. And like our UCSF employees, 9 times out of 10, we're not going to go get it. So another thing is to avoid saturated food environments. For me personally, after studying these companies and what they're doing to the health of nations, I view it as a political stand to not spend money on junk food and soda. For me, it's about not wanting to support companies like this. And if you're interested, I'm also doing some work on what's happening environmentally around the world with soda companies and water scarcity, and I can answer questions on that. But as I see the effect of these companies in our food system on our environment, I am more and more turned off of participating in their business model. And so anything you can do to build in environmental nudges that even simple things like not owning a car and having a bike, you're going to exercise more, right? So we can put these very basic findings from behavioral science into action anywhere. Another important thing is that prohibition on its own, just telling people don't smoke, don't drink, it doesn't tend to work. It usually backfires. And so the way we like to have learned over time in public health is to just create environments that discourage the behavior but aren't draconian. So it was never our intention to tell people whether they should drink soda or not. We just didn't want to sell it. And those are the kinds of approaches that tend to, and also over time, just kind of dialing down the unhealthy products is a better way to go than, say, alcohol prohibition, where we just made it illegal. And so we're learning this across the board in public health, that if you require anything of the population, especially in America, whether it's wearing a mask or drinking soda, not drinking soda, you will get pushback. And so it's better to, where you can, create environments that just naturally encourage people to do the right thing for health. And that this message of social contagion is really important, that the more of us that just deploy healthy nutrition, the more people are going to participate. We know, for example, from studies of Alcoholics Anonymous, that the biggest impact of AA isn't even the spiritual recovery program or any of the things that you might think. It's the changes that people make in their social networks when they go into recovery. And if you are, essentially what happens is people replace their drinking buddies with AA members who don't drink. And then everyone in their social network is constantly reinforcing abstention. And so they're literally re-rigging their social environment to support a healthier way of life. And so even small changes that we make, just walking around with a water bottle, are socially contagious and can lead people around us to notice and do the same. And then finally, activism overcomes the fallacy of individualism. So as I mentioned at the very get-go, this study on England showing, well, all those diet and nutrition programs and exercise programs, they didn't work. and we're not even learning that they didn't work. We're demanding individuals make all these changes and fight a toxic food environment, as opposed to making that toxic food environment less toxic to them and not asking anything of them. In fact, if you want to use products that are unhealthy, you got to go out of your way to do it. And so this idea of desaturating the environment is very important, and it does require political action and policy change. And the more you get involved in politics and policy, the more you overcome that idea that we are each independent, autonomous actors, and you realize how interconnected we are, and how my health is dependent on your health, and that activism and making our environment a better place for all of us is the right thing to do. So here's sugarscience.org is a UCSF health education effort. And if you're welcome to go there and learn more. And with that, I will stop and we can talk a little bit. See in the chat. I don't know if somebody is interested to see waist circumference and waist height ratio broken out by, oh yeah. That's a great suggestion, Deanna, to break out that waist circumference across profession. And I think that's a good one. And I'm sure at baseline, it follows that occupational gradient, just like everything else. Any other comments?
Thank you so much, Dr. Schmidt, for speaking. Does anyone have any questions? Feel free to send it in the chat. We'll see if we have any questions.
Hi, Dr. Schmidt. Thank you so much for talking with us today. I found your presentation really interesting. I was just wondering how you got involved in this research.
Oh, yeah. It was actually like everything, it's about your colleagues. And what happened was, I'd been doing research on alcohol for many years and looking at these issues in a very similar way, but around alcohol. And an endocrinologist at UCSF, he ran the pediatric obesity clinic in Children's Hospital. Rob Lustig showed up at my door one day and he said, I heard that you know about how to regulate stuff. Have you ever thought about, thinking about regulating soda and sugar? And that was a really interesting idea that I hadn't thought about. I'd been off in my little corner. And the thing that was really kind of stunning for me was when I started to look at the population burden and the health, and it's like with alcohol, every country in the world has a tax. We've only got 37 countries in the world with a tax on soda. With alcohol, virtually every country in the world limits availability to children. With soda, we're feeding soda to children. And yet, if you actually look, Rob and I published a paper in 2012 in Nature that actually made the case. If you look at the things that alcohol does in terms of health outcomes, fatty liver, high blood pressure, heart disease, a lot of the same things happen with sugar. And yet one is highly regulated all over the world, and the other is completely unregulated in the context of a massive rising obesity pandemic. And so the idea that we wouldn't be, it just more and more, the more I thought about it, the more I realized we've got to do something. And the tools that we know work for alcohol and tobacco could so easily be applied in this area. And the health more significant. Just look at the overall population burden on health. Poor nutrition is next to tobacco. And so why wouldn't we be? And so a lot of it had to do with just really seeing the scope of the problem and realizing that I knew I had some tools for how to address it. And Rob is one of those frustrated doctors, and not the only one that I work with. I have a colleague who cuts feet and legs off and has to amputate diabetic limbs that have gone necrotic, and people who are going blind from type 2 diabetes that's gone uncontrolled. And so if you spend your day kind of cleaning up the carnage from this mess of a food system, at a certain point, it does make you frustrated. Like, why this way? Why do we wait for people to get sick and live for years with uncontrolled medical conditions before we do something? And so Rob is not the only frustrated doctor that I work with. And also a lot of my students, I have to say, I've had many heart-to-heart conversations with young clinicians and doctors that I mentor, who are really asking these questions, like, should I just sit by and treat one patient at a time, or should I try to do something that has a bigger impact? And particularly people who work with communities of color and low-income populations. It's really, really hard to do that work on a day-to-day basis and send people out into environments that are just completely unhealthy and constantly working against their very efforts to improve their health. Thank you, Mariel. The question is pushback. Yes, I live and breathe corporate soda company pushback. It's pretty significant. It's a big issue for people in my line of work. And many of us, I'm not alone, have been subjected to quite a bit of scientific harassment and various, everything from legal requests for me to make public my email, which is allowed under Freedom of Information Acts because I work at a public university, to scary emails, to scary text messages. And, there's a lot of money at stake. These large transnational food and beverage companies, they all already have a corporate espionage arm because they're constantly worried about their competitors finding out their secrets and so forth. And so it's not outside of their skill set to, think about this. The worst case, which was my colleagues in Mexico City, who had government issued spyware on their phones. And it turns out like they're the leading advocates for the Mexican soda tax and nutrition scientists working on the tax. So the kind of harassment you see for public health professionals under COVID, it's been around for a long time. And people in the tobacco world and people in working on toxic chemicals in the environment, climate change, it's not uncommon, and it's sort of a cost of doing business. And fortunately, I'm very lucky that my university's general counsel's office is very skilled at and engaged with helping people like me and protecting faculty and our academic freedom to say what we think and what we find in our research. And so, yeah, it is crazy dealing with all that. I didn't expect it. And the first time it happened, it was very stressful. But then after a while, you really get used to it and you learn skills for protecting yourself. And we're very, very careful with our privacy and encryption and all of that for this reason. So you mentioned changes in food policy in Chile. You were just there for 4 months. And it's true, very difficult. Yeah. The default, it's an interesting unintended side effect of this. Shadowing bariatric docs, I observed several patients who seemed entirely unaware of sugar. True. Yeah. Getting the information out. And that's why the Chilean warning label has been so effective, I think, because you have a population that's probably not all that sensitized to the health harms of sugar in the diet, unlike in the US, where people are becoming more and more aware. And so that warning label on the front of the package is really helpful in a context like that. And lots of billboards and free buckets of cola. Yes, that is. And it looks like I see a hand up, Sarah. No, maybe.
I'm not sure if they handed up there accidentally or it's I'm not too sure. All right. I think, did anyone else have any more questions?
Okay.
All righty. Thank you so much for having me.
Yes, and good luck with all of with med school.
Thank you. That's so crazy with your story and the espionage and the impact of the soda, and it's really interesting. Thank you for speaking today.
Sure. Take care, everybody. Bye.